Aisha. So I'm going to be your nurse today. My name's Anastasia. Could I get your name and date of birth?
My name is Aisha Jones, and my date of birth is January 10th, 1989.
All right, great. So I'm going to get a couple of vital signs on you, and we're going to go through what your procedure will be like with the thoracentesis.
Okay.
All right, great. So I'm going to create some patient privacy, and we're going to listen to your lung sounds and get a baseline for your vital signs. Is that all right?
Awesome. Okay.
Okay, so if you could lean forward, and every time you feel the diaphragm of this on your back, you take a deep breath. All right, again. Okay, again. 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 And one more time. All right. So it does sound like I can't get any breath sounds on your lower right lobe.
Okay.
So that would confirm that we do. That would be a further confirmation that we do need to get a thoracentesis. But I will also get your blood pressure.
Okay.
And let's get your blood pressure. Looks good. And we will get your pulse ox. So let me see your finger. And a temperature. And so how much pain are you in right now? On a scale of 1 to 10.
I'm having like an 8 right now.
An 8? Okay.
Yeah.
All right. I'll go get the physician right away then.
Mrs. Jones, how are you doing?
I'm having a little bit of trouble breathing, Doc.
All right, well, I'm Dr. Mark, and I'm going to be your doctor for today. So the nurse, Anna, she let me know that you're having trouble breathing on your right side.
Yes.
And
yes.
you're having a lot of pressure there, and it's painful.
Absolutely.
All right, from your x-ray, it shows that you have a pleural effusion. Do you know what that is?
No, I'm not quite sure, doctor.
So you have some fluid buildup under your lung, and that's why it's hard for you to breathe. So what we're going to do is we're going to go in and we're going to insert a needle and we're going to draw all the fluid out, and that's going to relieve some of the pressure, okay?
Okay.
Okay? All right. I'm going to get everything set up, and we'll come back and we'll get ready for the procedure, okay?
Okay.
All right, I'll be right back. Okay.
All right. Hi, Aisha. So let me just check your IV before we get anything started. All right. It looks great. And then do you have any questions before the doctor comes back?
I'm not so confident with the explanation as to what's going to happen. Can you help me out with that?
Of course. So I have a pamphlet. Let me bring it to you. I have a pamphlet about thoracentesis, and it'll tell you almost everything you wanted to know. And the doctor also ordered a video if you would like to see that one too.
Sure.
Okay.
The chest wall, a condition known as a pleural effusion, or have an infected pleural effusion called an empyema. A procedure known as a thoracentesis may be performed to determine the cause. During this procedure, a long, thin needle is inserted between the ribs and used to withdraw fluid from the pleural space. Again, this fluid is sent to the lab. If there is a large amount of fluid in the pleural space, a chest tube may be inserted to help it drain.
A thoracentesis is the insertion of a large bore needle through the chest wall into the pleural space to obtain a specimen of diagnostic evaluation, to remove the pleural fluid or instill medication. The patient is positioned in an upright position with their elbows on the overhead table and their feet supported. The skin is cleansed and the local anesthetic is injected subcutaneously. The chest tube may be inserted afterwards.
All right, Aisha. So your procedure is done, and we're going to put a sterile dressing on. Okay, so let's put that sterile dressing on right there, and tape the top, tape the bottom. So do you have any rapid heart rate or chest pain or anything like that?
Not at the moment.
Okay. No trouble breathing?
I'm actually breathing a little bit better now.
All right, that's good. Then that means that worked. So when you have someone change your dressing, you're going to take off the old dressing, the dirty one, with the tape and everything, and then you're going to rinse it with sterile water, and then you're going to have someone put new gauze on there and new tape, okay?
Okay. Is there anything I should look out for when I change the dressing?
Oh, yes, you should definitely look out for redness or heat, any sort of discoloration that is different from maybe a slight bruise. So if you're seeing something that does not look normal, like maybe fluid coming out of the wound, anything like that, that would be sign of infection.
And what do I do if I'm at home and I see all those things?
You'll have to come back or call your physician, and they'll have to bring you back in and treat you for that infection.
Okay, I have to do that right away?
Right away.
Oh, okay.
All right, now that we've placed your dressing, we're going to have you lay on your non-affected side, so it'll be your left side,
Oh, okay.
away from your puncture wound, okay?
Okay. And what's this going to do?
This will promote healing and help your lung re-expand, okay?
Oh,
So
okay.
you're not putting any pressure on it.
Okay.
So then we would review the patient's labs and their x-rays done by the provider and look for any abnormal results.
I tolerated the procedure well with no signs of respiratory distress, and all of my labs and chest x-rays came back within normal limits. I was compliant in using my incentive spirometer, and it decreased my hospital stay by 2 whole days. My hospital stay was decreased from the normal 10 days down to 8 days due to the use of the incentive spirometer. I also experienced a 20% increase of inspiratory and expiratory vital capacity prior to the end of my 8-day stay. I was able to verbally show wound care, dressing care, and also I was able to verbally express the signs and symptoms of wound infection, and I know that I should come back to the doctor if I see any of those things. And I also understand if I should have shortness of breath, or if I have an increased heart rate, I should report to emergency services and contact my physician right away.